Hello, this is Dr. Marzban from Complete Injury Centers, and we have discussed the lower back pain in previous videos, and you can refer to those as well. But as we mentioned before, lower back pain could be caused by many different reasons, and the issue that we are going to be focusing on is when the patients come, which we see that very often, is that patient is complaining of the lower back pain in this area right here and in the groin area. And patient complains that when I try to get up, it is hard, and bending forward, it is bothering, and also laying down on the bed, and when I have my legs straight, it is difficult. Getting up from the bed is also not comfortable, and all of those again could be because of the multiple different reasons, not one, or it could be a combination of a bunch of things. But one of the major cause of having the lower back pain as well as the groin pain is because of this set of muscle right here. Is called iliopsoas muscle. It is made of the psoas muscle right here and the iliacus muscle right here, and you see that both of those are attached to the femur of the hip bone, and it is attached to the medial side of it. It's called the lesser trochanter. It's just a name, and the function of the psoas muscle is bring the hip forward, like as such. And also is going to push, as you see that, here's the muscle right here, as you see that it causes the lower back spine, lumbar, to push forward. So it's going to increase that curvature of the lower back, which is called the lordosis. So if this muscle is tight, it causes the tension in the lower back deep to the abdomen. So the patient said, well, it is not right here, it's deep into the belly. And also, they're going to complain about the area of the groin area that is tender, and it is painful. And again, we will talk about that issue of other possibilities of having those kind of symptoms on the PowerPoints. But what we are trying to do, showing in this model, is that you can observe and see where these muscles are. Beside the psoas muscle right here, we have the iliacus muscle as such, and the iliacus muscle, it is not attached to the vertebrae. And this iliacus muscle, what it does is only flexion of the hip, so it's going to be as such. So the psoas muscle is more complicated muscle, and has more connections to the spine, and it has multiple functions. Again, we'll see more of that in the next section, which is going to be the PowerPoint presentation. Hopefully you will enjoy it. Hello, this is Dr. Marzban from CIC, Complete Injury Centers. And today's topic is the iliopsoas muscle and back pain. And as we discussed that earlier in this video, the back pain it can be associated with the multiple different causes, and today we're going to be focusing on the iliopsoas muscle, how that can contribute to the lower back pain. And here's the lower back pain, and we have experienced that, or we have seen people they have experienced that, and it is not a very comfortable thing. And the lower back pain can be, as we said, can be caused by multiple different things. And one of the things that can cause the lower back pain is the posture, that how you hold it, where you're sitting, standing, and the seeing the screens, and if they're not balanced and adjusted to your height, then that cause also issues with the lower back. And these are those examples of that. And but today we're going to be talking about the lower back pain associated with iliopsoas muscle, but also these type of patients, they are complaining of pain in the groin area. And so if that is the case with the lower back pain, the groin area, and you're looking for one simple cause of that, and that cause both of those, that would be the iliopsoas muscle. But again, different things, different issues can cause a lower back pain or the growing pain at different times in different way of presenting themselves. Let's review some of those. Here's the lower back pain. People, they have the disc issues, the herniation, and that is very common thing that we see that in amongst our patients that they are in the car accident, auto accidents, the sport accidents, and again, aging is also the one of the possibility that this can be injured. The cancer is something that we always have to consider as the possible cause, and so therefore we have to be careful about that one. And again, kidney stone and one or multiple can cause the lower back pain, and the muscle spasm and pain. The lower back has many types of muscles that can be irritated and can be painful. And again, there are visceral organs, referral pain, and like your stomach, intestine, colon, and pancreas, and kidney, and everything else can give the referral pain, like a kidney stone does for the lower back pain. And then you can have the broken spine, bone, and that also is it is a possibility, and therefore it is a good thing to get the X-rays done to see that if that is issue. Every one of those that could be a possible cause of the lower back pain, you always have to see other symptoms, other issues the patient has to narrow down to what if, of those causes could be the possible cause. And again, you don't chase after one. It could be multiple different causes at the same time that the patient is coming to your office for treatment. And let's talk about the growing pain. Instead of the smaller disc herniation, we can have inguinal herniation, and that you're familiar with, and that is going to be right at the growing area, and the patient feels pain. And lymph node is swollen. Swollen lymph nodes could be causing the growing pain, and that again, it could be an indication of some serious condition for the patient, like cancer, and therefore it will be interesting, not necessarily interesting in good way, but it would be patients types that you need to be more consider about the well-being of the patient and doing the right things. And again, the cancer, lymph node, and visceral organs issues, they are out of scope of the chiropractic treatments. And again, we, as a chiropractor, as a clinician, we have to be having open ideas that what would be the best for the patient and what we can do for the referrals. Kidney stones, again, can cause the not only lower back pain, it could cause the growing pain, muscle spasm. Again, what type of muscles we are dealing with? There, as I said it, there are a whole bunch of muscles in the lower back. Some of them are going all the way to the growing area, like iliac psoas muscle that we are interested in, and that cause the growing pain and back pain, or a combination of the two. And then hip inflammation, we're going to talk about a little bit of that. We talk about that hip inflammation a little bit more detail in the other video. And so hip inflammation can cause the growing pain. And again, the broken bone in pelvis and hip, which could be because of the trauma or aging, falling, and could be causing growing pain as well. But the thing is that the iliac psoas muscle is the type of muscle that we call it the riptide muscle. And this is the psoas muscle. Here's the iliacus muscle. You see that this muscle right here is attached to the side of the spine. This muscle is attached to the inner part of the pelvis, and both of those are connected to this growing area or protrusion. of the bone, which is called the lesser trochanter of the femur of the hip complex structure. And beside that, we have that psoas minor, which is sitting right here, which we are not going to be focused on that one as much because it has a different insertion than the other two muscles do. These muscles are called the reptile muscle, fight and flight muscle, sympathetic muscle, and the primitive muscle, and reptilian muscle. And because this is one of the earlier muscles that species came out with to move around with the legs and to flex the hip. And it was not much for the lower back movements, and it is more of the hip flexion. And so the psoas muscle, what it does, it has connection to this part of the femur right here. It causes the hip flexion, as well as it has some effect on the lower back, which we're going to talk about that momentarily. And with this hip flexion, as you can see that because of insertion, which is more medial side, inner part of the bone, it causes the external rotation of the hip as well. And there's no muscle that you can have a simple motion for it. There's always a complex motion for each muscle function, and that iliopsoas muscle is not an exception muscle, and therefore it has the complex movements. And so here's the iliacus muscle. It is not attached to the vertebrae. This one right here may not be causing the lower back pain, whereas the psoas muscle does, but both of those could cause the irritation of the area in the groin area. Why I put this slide right here with this fight and flight sympathetic muscle, primitive muscle, reptilian muscle, is because that when people that are under stress, this muscle can be tightened up, and therefore the stressful daily life can cause this muscle to become spastic, and which is going to be ending up to the lower back pain and the growing pain. And if you look at this picture right here, this shows that three levels of the central nervous system, from primitive, intermediate, and the newer part. And here is the reptilian part of the brain, which controls your iliopsoas muscle. This part of the reptilian is under control of the other part of the brain, more newer than the reptilian, and that is the emotional part, a limbic part, and that's why I was mentioning that if somebody is under stress, in a stressful daily life, can make this reptilian part of the brain to become irritated. Whereas the newer part, which is more advanced and it is more developed in human, and is the executive state, and that controls this emotional part of the brain, and should. But these two should be balancing out. But what would happen if you have an increase in the emotional part of the brain? This means that this frontal, it is not controlling, it is not powerful to do it, and this emotional part is going to take over. So here it gives the negative effect on the brain in the front, which is the frontal lobe, and therefore the functionality of this frontal lobe, the executive part, cognition, planning, memory, and a whole bunch of advanced brain function, it decreases. Whereas the reptilian becomes more powerful, and when the reptilian becomes more powerful because of the stressful issue that caused the limbic brain to become stronger, and the reptilian brain becomes stronger, which makes it the iliopsoas muscle to become tightened up. And here is the iliacus right here. Here's the psoas muscle right here, and here is the psoas muscle by itself, as we described that the psoas muscle is attached to the side of the lower part of the spine, lumbar area, and is going to the same area that the iliacus is attached to the lesser trochanter. And therefore, if these muscles combination are tightened up, or only the psoas muscle itself, it can cause the lower back pain with the growing pain. So here is the pain that the patient is going to feel. This is the frontal view, and all this area can be painful. And this muscle right here is very, very deep, and therefore, when when this muscle has become spastic and tighten up, and there's the inflammation going on with this muscle, patient is going to feel the pain in the lower back, but they describe it deep into the abdomen. And they're not complaining much of the spine directly. Yes, there's going to be some irritation to this spine because of the rotational and flexion issues that the patient is going to feel, but the pain that the patient is describing due to the muscle spasm initially is going to be the deep pain in the abdomen. Here are the location of the let me just go back. Here are the locations of the pain that the patient is complaining. And here is the iliopsoas muscle attached to the side of the spine, lumbar, and here's the femur right here. And what it does, normally it should bring the lower part of the spine forward, and they cause the flexion of the hip. But that should be a normal tension on this one. Otherwise, if it is a tightness right here, it's going to cause the lower back spine to become more curvature, and as well as it is going to bring the hip forward or the leg forward. You see that there is a line right here I draw, and you notice that the hip is forward. And that's why I'm saying that patient is going to be having a hard time to lay down on his back and leg straight, because that is going to put the tension on this muscle, which is already spastic. And then laying down, it is also putting some tension on the lower back if it is already under stress due to the iliopsoas spastic condition. And here it shows that we have the rotational movements of the hip and pelvis, and there are a bunch of muscles that they do at different directions. And again, the rotational part of that, which are opposite to each other, should be balanced. And if there's the lack of the power and balance, then the lower back as well as the pelvis and the hip, they are becoming under stress, and then there are going to be some type of pain, inflammation, and tenderness in the area. So the balance of these muscles, which are a bunch of those, should be considered to work together. And if one is weak, the other one is stronger or spastic or tight, then us as the clinician should be able to figure out which muscle is the problem and give the right treatment for the patient to balance out the lower back. Here is the psoas muscle right here attached to the side of the spine. Here's the femur right here inside, and you notice that it is a long, strong, and very primitive part of the muscle groups. And what it does when you have your hip, your leg straight, then it's going to put the tension on the lower back to go forward. As you bend your hip, then you relax this muscle, the curvature of the lumbar gets less, and therefore this muscle becomes rested. And so I put the contracted muscle right here, but at the same time, when you bend your hip as such, it causes the relaxation of this muscle right here. This is a stretching part when your leg is straight. Therefore, the patient, when he's laying down and the leg is straight, they feel pain in the lower back as well as the growing area. When they flex, they feel less of the pain in the areas. And the curl up exercises that people they do and you're familiar with is for abdominal muscle exercise. And in order to exercise this muscle right here in the abdomen, and therefore you don't want to be exercising the iliopsoas muscle. In order to isolate this muscle of the abdomen, and you have to bend your hip and the knees. And by doing so, you are relaxing the iliopsoas muscle, and therefore you're not working that out. If this is the muscle that you need to exercise, not this one, in order to bring the balance in the lower back. But at the same time, making sure that the neck is not bent forward too much and is holding the straight neck as it normally should, and putting your hands behind your neck and push it forward, which many of the people they do when they do the curl up exercises, they are not doing it the right job. Here's the type of stretching that we recommend, and I'm sure you're familiar with that. You did it in the school, in colleges, when you are in the sport team, and to stretch this muscle right here, which is very important for the athletes. And here are the different types of stretching and extending, and here is the putting less pressure on the iliopsoas muscle, but at the same time you can bring it forward your legs, and that is going to cause this muscle to stretch out. And simply you can put the pillow right here, and that should do it. But you can make it fancier and buy blocks or something fancier to put it under your lower back when you're laying down to do this type of stretching and exercising. And here is the another way of stretching this muscle right here, just laying down on the side of the table, bring the hip back, and leg is going to be resting on the side of the table. And you can make it even stronger by bringing the other hip toward your, I'm sorry, other knee toward your chest. And you notice that brings the leg up because if you have a tightness of this muscle right here, therefore it is going to lift up the other knee, but you're going to be pressing it down toward the floor to keep that stretching to hold. Here's the regular picture right here with the lady sitting or laying down on the table. And it shows that you can use the exercise tool and bring the pressure of the leg toward the floor. Or you can just simply, you can do that yourself by pushing it down. And here is the more stretching to the iliopsoas muscle by holding up the knee toward your chest. And beside that, we need to also mention the iliopsoas bursa, which bursa is the sac structure, helps with the reduction of the friction between the different structures of the body, between like muscles and the bone and the joint right here. And when this muscle, the iliopsoas muscle, is tightened up and put the tension on the hip joint, this iliopsoas muscle, in order to protect it, it is going to be sitting right there, but under pressure, it becomes irritated, and it causes the we would call it bursitis, inflammation of this bursa. And inflammation of the bursa itself can cause the pain, and therefore, not only the pain is going to be due to the muscle tightness, it could be due to the bursitis that the patient is experiencing. Again, with that type of scenario, climbing up the stairs would be very difficult and put the pressure on this bursa, because every time you're putting a step up your foot, you need to flex the hip, and when you're standing on it, then you're going to be stretching that muscle right here, which is going to put the pressure on the bursa at this location. And here is the real sus bursa, and here would be the uh, location of the bursa itself. There is a nerve, it's called genitofemoral nerve, and which passes through this muscle. And if this muscle is tightened up, not only cause the bursitis, possibly, it also could put the compression on this nerve right here, genitofemoral. And the genitofemoral has the distribution of the sensory in the growing area in the front of your hip. And this is going to be more skin type of irritation, sensory irritation, and therefore that also could exaggerate the issue of the growing pain that the patient feels due to the nerve irritation that passes through this muscle. Hopefully this set of PowerPoints and the presentation is helpful to you as a patient and as a clinician, and hopefully we can work out together and make the society healthier. And from CIC, Complete Injury Centers, I thank you, and hopefully we'll meet again soon, and you have a wonderful day.